Welcome back to another episode of Nurturing Humboldt. I am so excited for this conversation today that you get to listen into. I had the absolute pleasure of sitting down for a relaxed and thoughtful conversation with Dr. Carrie Griffin. Dr. Griffin is a physician, a healer, and a lifelong student of transformation who brings an incredibly unique lens to her work here in Humboldt County. From her early experiences with yoga, Tantra, and somatic healing to her current work in addiction medicine, reproductive health, and trauma-informed care, Dr. Griffin's journey is all about honoring the body's innate capacity to heal. This episode was such a fun and casual conversation. We laughed, reflected, and got curious together about healing, medicine, and the beautiful messiness of being human. I hope that you get curious during this conversation, and I'm so excited to have her back in future episodes where we can really dive deep into topics that she knows so much about, like birth and postpartum, psychedelic medicine. But for today's episode, listen with curiosity, grab a cup of tea, or go for a walk and come hang out with us. I feel kind of, in a way, like proud. I think it's really awesome when people let their curiosity kind of lead them and take them where they want to. And maybe I'm putting assumptions on you, but that's kind of what the energy that I've got is like, you are curious about things and you just let it take you, and you haven't let yourself be in like a mold. You've been like, what does it mean to be a human, and what does it mean to heal in different ways? So as much as you can be proud of a stranger,
I feel what a unique experience of sitting down with someone for the first time and feeling so seen so quickly. And no, you've named it. I would say that curiosity is one of my core values. And yes, I think that a kind look at my life so far has been, wow, she really let curiosity lead her. And she thus far has been pretty unafraid about it's funny to me that the choices I've made actually haven't felt like changing paths exactly. To me, I feel like there's all of the old selves are still very much inside me, right? Like the Matryoshka dolls, I just keep adding more dolls on top and kind of like moving back and forth between them. But thank you for that observation. That was very beautiful.
Of course. For those that maybe haven't done this much digging around and learning about you, can you give us an introduction in your own words and tell us a little bit about your journey?
Absolutely. So I am a physician. I'm boarded in family medicine and addiction medicine. And I did fellowship training in maternal, child, and reproductive health. All of that led to a clinical interest in perinatal substance use. And it was in working with pregnant people who were actively struggling with addiction that and birthing people. It was any experiences of birth and working with addiction that I really became so fascinated by trauma, because a sort of classic Western allopathic model didn't teach me how to actually work with that. And that was the thing I really wanted to understand. That was the thing I was most drawn to, really helping transform for other people. So that's sort of how my professional life is. But what drew me to medicine was, before this, I was a yoga teacher and a yoga therapist. I lived at Yogaville, which is an ashram in outside of Charlottesville, Virginia, before I went to medical school. I know literally called Yogaville. It's Sri Swami Satchidananda's ashram. But so I really was on sort of a different course, but it was important to me to have sort of a practical way to be of service in the world.
Yeah.
And I ended up in Humboldt through a series of strange synchronicities, as a lot of people, I think, seem to.
Yeah.
But I had just taken an osteopathic cranial course up in Gold Beach, Oregon.
Okay.
So I am a DO, not an MD, and was really intentional about that choice. And I still use my hands to treat people, treat babies. And I took that course. I was driving down because I was going to a conference at UCSF, and I stopped in Arcata for the night and was like, this place is weird and fascinating, and had wandered through the trees a little bit between Crescent City and here, and felt appropriately awed and reverent and fearful of the trees. I was like, oh my gosh, these feel like ancient wise sources that might devour me. I mean, like, truly, I was like, there's a primeval energy here that I think I'm afraid of, but also sort of, again, in deep bow of reverence to. And then I went to San Francisco And it was there that of this huge conference full of physicians and midwives, I sat next to Dr. Tim Nicely. And he has been in this community for a long time, working primarily in the Native community. And then he had started a private practice. And he was familiar with where I did fellowship, which is known for having a pretty rigorous reputation at the University of New Mexico. And he was like, "Do you want to join my practice?" And Lord love him, he recruited me hard. He kept contacting me even when I kept kind of ghosting. I mean, I wasn't ghosting him. I was just being a fellow. I was very busy. And he flew me out in December for an interview, just that really peak time to witness Humboldt. And we did a week. Was it a week? It was at least 4 or 5 days where I followed his schedule, which I think was a crazy thing to do. I mean, I like rounded with him in the hospital in the mornings and went all over and met all of these different sort of clinics and clinical systems. But really what brought me here was seeing the level 2 NICU at what was then St. Joseph's, now Providence St. Joseph's, and hearing about how opiate exposed newborns were being treated. And what I discovered was some of the wildest, most non-evidence-based care I had ever heard of. I mean, opiate tapering protocols that like tapering the opioid every 5 to 7 days. I mean, they had these tremendously long lengths of stay for these newborns. And I, at that time, was innocent and full of hubris, like you can be when you're still really idealistic. And I just thought I was going to come here and make a bunch of things better. Uh, and in a lot of ways, I feel like this community enabled me to do that, especially with our hospital treatment of substance exposed newborns. I mean, we may still be one of the only rural hospitals that has adopted a more family-centered treatment for opioid withdrawal, which is called Eat, Sleep, Console. And I'm incredibly proud that Mad River, when we still had a labor and delivery and a postpartum unit, and now Providence has continued with that care. And yeah, that's how I ended up here.
Thank you. It's so interesting what people. I'm reading this book right now. It's called The Black Swan. I just started it, but it talks about those moments in our lives, these random moments, right? That actually aren't so random, but they're very unpredictable, and they're the catalyst for everything else that happens.
It is so fascinating to think about this, right? These little moments, and I feel very fortunate in that I've lived in a lot of different parts of this country. And the way I think about how I transitioned from place to place or thing to thing, and it's such small, unusual. It's not the sort of cataclysmic. There's no scroll from overhead being handed to me, as much as I may desperately want that, even now at times in my life. No, it's these like little things that we just have to be cognizant of and paying attention to, and like, where's the yes? Right? Like, is there a yes in our bodies as we, stumble upon a town in Arcata and then meet a physician from there the next day? And that, just all of those little,
That's really special. I want to have like two thoughts. One, I want to know a little bit more about the work that you just mentioned, because it sounds amazing. And I just want to highlight again for those listening, like the strength that Humboldt has and the uniqueness is that we are so creative and we push these systems to kind of change and to integrate new things that work, that are family centered. So that really spoke to me.
And I just want to echo that. I mean, Humboldt struggles to retain physicians, right? Like, we struggle to maintain a robust medical force. And one of the things that I wish people knew this after medical training, whether they're an advanced practice clinician, whether they're a physician, whether they're a nurse. But one of the things that has kept me here is that it is a community that is so open to change. If you're able to, put yourself out there, advocate strongly and consistently. Right. I mean, I think that I sometimes get frustrated with community-based inertia, right? Where I'm like, people aren't responding to this fast enough. I always have to check myself, right? Because where is that my whiteness? Where is that capitalism? Like, where's that my childhood trauma, urgency, right? So it's like a delicate thing, balancing that urgency, because it's got some nefarious roots, but it can also be very effective. But I feel like I've had a career in a really early point, right? I'm really just entering kind of mid-careerhood, and I can already I can see places where I've had an impact. I can see ways where I've started programs. I can see ways where I've helped start programs and now need to go back and do another round of training because people have already, started their awareness has started to shift away from the core reason why these things started. So I think this place is really, if you're willing to be a little scrappy,
Yeah.
and if you're willing to not have a Trader Joe's and some of these other amenities that people say they want or need, I think this is an amazing place to live.
Yeah, I feel like you got to get weird and then you'll be okay.
I think weird and consistent, right? Like as long as you're just like really like just staying clear to your message and being creative. But I think one of the greatest gifts is often, I feel like a lot of community-based projects I support at this point, part of my helpfulness is actually like it's a very soft skill. It's like, oh, let me just call that person.
Yes.
Like, let me text them during this meeting because I can get an answer for you. Or like, oh, you don't know that guy? Well, like, I know that guy. So like, let me talk to him. And I feel really lucky that I've only been here since 2018. And I do feel like I'm able to kind of have a lot of those softer connections.
That's beautiful. I do also want to say that I'm glad that you found something that keeps you here. I had a colleague of mine be like, we were talking that you were coming to the interview, and they said, she does such incredible work. I'm like, don't leave Humboldt, please. Please don't leave us. So not to put more pressure, but I am glad that you're finding that your place here, and that it is nice to see the work that you do pay off, and know when you need to come back, and like, okay, let's keep it going. So yeah, your name is definitely carries weight around here. And I had that question that I sent you, and kind of talking about that book, I think probably inspired me, because I know that you had that shift when you were 19, then something happened that kind of changed your trajectory.
Totally.
So my curiosity is, if you want to speak about it, but also when you were there, did you know it was a pivotal point, or it wasn't until later that you were like, oh, that was the point?
No, I think I knew.
Yeah.
I think I knew. And I don't mind. I feel like I shared this story more and more freely. But I failed out of college at 19. And I can look back now at that 19-year-old. And I failed out because I was exquisitely depressed. And really the kind of depression I have, I didn't really have a name for until years later, which was really an existential depression. Life felt so meaningless.
Yeah.
I understood that I needed to make my own meaning. I had been aggressively nerdy as an adolescent, and really, I mean, I had friends in high school. We petitioned for like an existential literature class or some kind of year. I mean, we were cool, you can tell. But so this question of like, how do we make meaning was really dear to me. I was born with a lot of privilege, and that weighed really heavily on me, because I didn't feel like it was fair that I felt like there was so much suffering in the world when I had really been given, from like a structural perspective, so many advantages. So I felt a lot of shame about that. But I knew that I was just on a trajectory that really wasn't working for me. I'm from a smallish city in southeastern Virginia, and both my parents are attorneys, and I still have so much reverence for them. I just sort of like, I'm so proud of them and who they are and the work they've done in their community. And even though they had never put pressure on me or my brother to be an attorney, I just sort of assumed that, partially from being from a small city, and people sort of like, hey, Carrie, you're going to be an attorney like your daddy, like that kind of a thing. And it would not have been a good path for me. It's funny, this year I actually became a mediator, in part because I wanted to understand conflict resolution better, but I think also there's still that reverence and curiosity about the work that both my parents have done and still do in the world. But yeah, there was just so much. I did not have the emotional coping skills to like be a human at 19. And I'm one of those late summer birthdays, just like all of the things, like I was not equipped to launch. And I knew it was really important. I knew and felt like it was going to be a reset. And during that time, what started happening is, so many changes. I moved back home. I started working just a very basic administrative assistant job at a fastener distribution center. I'm from the largest naval base, like Norfolk, Virginia is the largest naval base on the East Coast. And honestly, my work I could do in about an hour a day. It really is not something that required anything. So I was reading voraciously again as soon as my attention came back and I could read. But I started meditating, and I started practicing yoga, and I started just looking for more meaning. I remember meeting with the pastor at the church I grew up in. And boy, God, I was a nightmare. I would not have wanted me in a confirmation and anything like that, because I was just like, constantly. I was just like, tell me more about this.
Yeah.
Explain to me why everybody goes to hell if they don't believe the same thing. I'm really struggling with this piece of theology. And I started looking for other traditions and other philosophies because I did not find it in. This is not to say that a Christian faith or theology does not have. And since then, I found a lot of mystic Christian writers and contemplative traditions. But in my the small Protestant-based faith that I grew up in, it just wasn't. I couldn't find the depth or the ritual or the practice that I really needed to feel like I could build a life of meaning. Yeah, just chill 19-year-old girl thoughts over here.
Yeah. Casual.
Just casual estimating of all of this and why is there so much suffering in the world, right?
I hope for anyone listening that maybe they're feeling something along these lines, that maybe they've gotten language now.
Yeah.
Maybe that's what I'm feeling. I really appreciate all of that. And I feel like hearing you talk makes me reflect so much on conversations that I've had with friends in different moments and the pressures that we put on ourselves, especially when we're so young. Because I've always, when I graduated college, I thought, why did I graduate when I was 22? It felt like I should start here.
Yeah.
And now that I'm, in my late 20s, I'm like, I'm at a new level of consciousness. This would make more sense now. So it's crazy.
Well, we know, right? We know that, that period of sort of adolescent to young adult brain development is really ends in your mid-20s, right? I feel like life is clever. There is some inner intelligence somewhere that's doing something.
Yeah.
I feel like I have a fair amount of teen clients that I see now, and I feel like a lot of my work has been helping them and their families understand that it's okay to slow down.
Yeah.
Like you don't have to march. And I think that one of the things because I do really identify as a Virginian and as a person who's from the Southeast. And what is so different about being in California is I'm sort of shocked to talk to all these parents who are so open to alternative education plans and the variety of education that's available. I'm so grateful for the education I had because it was tremendous. And it was very narrow, right? It was really like, this is what you're supposed to do as an upper middle class white person. Like, this is the path you're supposed to take. And slowing down is never a bad option, in part because all of us are experiencing trauma at some point. Birth is traumatic for all of us, even if it was the most beautiful birth in the world. But just the process of showing up embodied is hard and a gift, right? It's a both and all the time. But as we start to digest that, trauma happens because we haven't had time to integrate a threat. And we've either perceived that something is threatening us or something has actually threatened us and hurt us. And it happens faster than the speed of our nervous system to mount a defense, right? And so less and less, that is humans being chased by saber-toothed tigers. More and more, it's us coping with dysfunctional attunement in our family of origin or our community, or it's reckoning with these deeper cultural and social values that maybe don't feel like a fit for us or are harmful, right? Are actively harmful, which is what we know. Is that certain ways of economic change, certain ways of politics. We're talking on a day that this big, beautiful bill, saying the word beautiful around it makes me want to throw up, but that passed, right? And that will we don't know what the downstream consequences of that will be yet, but it makes it even more important for us to slow down so that we're not constantly reacting. And the same thing applies to 19-year-old Carrie Griffin. If she could just have slowed down, which is what happened, because that's what depression does. It slows us down, whether we want to or not.
Until you're like, you have to face it.
You got to face it.
You got to face it.
Yeah.
Thank you for sharing that.
Yeah.
Can you, because I think for listeners, they'll probably hear it in your language, that therapy talk, not therapy talk. That's not how I want to say it.
That's okay.
Well, I guess, therapy talk, but not in like a bad way, in a nice way, because you're calling out all the things that we all feel like in our outside life, outside of our professions, when we're talking with our friends or we're talking with our in all of our relationships, we're talking about all of these things, but maybe we don't have the right language or we don't understand what we're feeling. We're just feeling. And so when I need therapy talk, I'm like, you have the language and you're explaining, this is probably what we're feeling. Part of the reason why we really wanted to have you on the podcast is because, at First Five, we really try to share the voices of local experts or experts in the fields that are making impacts. And I think you definitely make an impact in our community, whether it's through birthing work or different trainings that you facilitate. So I want to dive into some of the trauma and nervous system work that you do. So you've studied somatic experiencing, internal family systems, and NARM therapy. For folks who've never heard of NARM, can you give us a little bit more of insight of what it is and how it supports healing in a deeper way?
Yeah, I would love
Yes.
to. So NARM is neuroaffective relational model, and it is a kind of therapy and therapy practice specifically for complex PTSD. It was developed by a man named Dr. Larry Heller and Dr. Aline LaPierre. And they've created with Brad Kammer, who is actually out of Ukiah, and where he wrote, I love that detail and that part of the NARM community. And for me, as a person whose background was in medicine and not psychiatry, as you know, family medicine, addiction medicine, um, I found it to be a really pivotal training because it focuses so clearly and precisely on how CPTSD can show up, and then it offers these 4 pillars of how you practice therapy in a way to work specifically with developmental trauma and the ways that personalities forge specific patterns that they call in this model survival strategies, and how this is what I love about NARM. And I went through my own NARM kind of therapy process adjacent to the training, is it takes the places where your personality is pretty stuck. You're like, I just can't get out of this run. And for me, a big one was pressure and urgency, right? Or what they would call in NARM autonomy survival style, feeling like it's all my responsibility. And if I can just take care of everything, then I will be worthy enough, good enough, deserving of love and connection. Something will be proven. And a lot of people in helping places have some autonomy survival strategies to them, as well as some attunement survival strategies where I can sense everyone's emotional needs around me. I have none of them. What do you mean?
Yeah.
So it's a really, and you know, with any of these models, they risk pathologizing ways of being, but it's a really, I would say it's a pretty foundational part of how I approach all care that I render in every setting, right? So even in a delivery room or even in like a prenatal appointment at Kamau or United Indian Health, I mean, I'm still tracking those same strategies in terms of how they're showing up and how the patient is relating to themselves and the care that they're there to receive.
Yeah. Sounds so interesting. The more that I see the world of healthcare and all of these little bubbles that are outside of it,
Yeah.
the more curious I get how they all kind of interweave. And I think you found kind of a very interesting way to do it. So how do you feel like all of the things that you have experience in and all of the trainings weave into how you show up in clinics?
That's a great question. Some of it is how surrendering to a process of engaging with those things, how it's changed me,
Mm.
right? And the way, not even the way that I show up, but I think increasingly, these are all things that have kind of worn down edges or layers and allow me more access to my authentic self
Mm.
and more presence.
Mm-hmm.
So I think that one is they help me stay more connected to the beingness that's already here, that doesn't actually require me to effort or craft or algorithmically apply a conversational protocol in this way.
Yeah.
Like there's just a beingness that becomes more resonant. And on a more practical level, I would say that actually it's somatic experiencing is what I first started studying. And it's, in fact, it's through the SE world that I learned about NARM. But what I love about somatic psychotherapy, SE in particular, and polyvagal theory is they provide me with a really easy way to do psychoeducation about the nervous system and about how someone might be showing up. So I would say that for a patient who's really angry or really panicked or anxious, instead of thinking about that automatically as a thing I need to fix, I do think that it's easier for me to be like, oh, they're sympathetics or they're really active right now. And there's a reason for that.
Mm-hmm.
They're perceiving threat somewhere. And somehow, even though I mean, a trigger is essentially that an old pattern has gotten reactivated, but because of something in the present environment or because of something that happened internally, right? It may not have been one of the examples I use in like a labor and delivery setting is all the noises, right? all the beeping and the movements and and some of that is like some people are really soothed by hearing the baby's heartbeat, for example, but maybe the IV pump is going off and that beeping might bring people back to a really negative hospitalization experience they had. It could bring people back to, professional experiences they've had if they've been deployed or if they have wartime experience. Who knows, right? It could be the beeping of a phone that was knocked off the hook in a case of sexual assault. I mean, we don't know.
Yeah.
And often people don't know, right? Because our brains are so good at keeping memories kind of hidden underneath the sort of other emotional responses. So I would really think that actually leaning into applying and really teaching about polyvagal theory is probably what shows up the most. If I'm so I sort of answered implicitly from like a very spiritual place and from a more sort of medical place, I would say that it's really using polyvagal theory and tracking kind of those components, no matter what setting I'm in.
So, for those of you that haven't heard of this theory as we are talking about it, the polyvagal theory, easily explained, is sometimes when your body just reacts to something before your brain even has a chance to catch up to it. Like your heart starts racing or suddenly you feel shut down or spaced out. That's what the polyvagal theory helps explain. It's all about how our nervous system responds to stress and safety. It focuses on the big nerve in our body called the vagus nerve. Think of it like a superhighway that connects your brain to your body, especially your heart, lungs, and gut. It helps your body figure out, am I safe or am I in danger? And so what's really special about this theory, especially when we think about it when we're using it in healing, with parenting and therapy, how Dr. Carrie uses it, it helps think about not just the brain, but about the whole body's experience of safety or threat. And it's really helpful when we're trying to connect human to human and thinking big picture of what could be going on. Why is my nervous system reacting this way? Instead of feeling broken or stuck, we're thinking bigger picture, what's going on with our nervous system. Listening to you, to me, it sounds like although you went through a lot of training, there's something inside, there's something about who you are that allows you to show up in this way that maybe can't be taught, or maybe it can be. But I was listening to an interview that you did for the NARM podcast, the Transforming Trauma podcast. I think it's episode 69 for folks that want to listen. But you were talking about how most medical trainings skip over how to truly connect with patients, how to validate trauma or listen deeply. Instead, providers are trained to kind of default prescribing. Can you talk more about that gap and what's possible when we lead with the presence instead of protocol, or, how we can merge both?
Again, I love this question because it's something I think deeply about all the time.
Yeah.
So I want to believe, and I think that there are parts of this that can be taught.
Okay.
I wonder, no, that's not true. I know it is true that I wonder sometimes if I knew what I knew at 25 when I sort of spontaneously applied to osteopathic medical school and got it in like 4 months, which was like, I was not planning to go to medical school. It just unfolded. I might have been better off as a therapist or kind of making other choices if I didn't have some of my own pressures and sort of urgencies. But I was also so curious about birth and the body and really there was something very practical that I felt like I needed to understand about the body and the body-mind connection. So it is what it is.
Yeah.
But I don't think there's time, and I think this is a true statement. There isn't time in the fire hose experience of medical education and residency and fellowship to really do justice to attunement work. Like there isn't. And I think I've now spent like all of this postgraduate time kind of doing that work and cobbling together a curriculum because I was so curious and because I wanted to know and because I felt like the care I was rendering was worse if I didn't know how to do this with greater depth and greater alacrity. And you're right, I did have kind of a raw, innate ability to do these things, but I also knew that I was getting into places in rooms with people in visits that were really vulnerable. People felt comfortable exposing a lot of their wounds to me. And there were, and sure, there's some innate capacity there, but there were also moments where I was like, I need skills and I need a framework. I need to understand more of what's happening here. And so one of the ways that I try to bridge this gap is I love to teach and will say yes to any opportunity to teach about a somatic approach to trauma-informed care to healthcare workers. I'll weave in somatic work to any kind of training I'm doing. Like I was just presenting at a conference in May, and I was really supposed to only be talking about the intersection between gender affirming care, substance use, and prenatal care. But I absolutely ended up in like a little polyvagal riff, which I think was the thing that several people afterwards were like, thank you so much. Because even though in the mental health world and in, sort of lots of other, certainly in a place like First Five, right, where you're so focused on the arc of development, there's a lot of conversation about attunement. There's a lot of conversation about nervous system regulation. There's awareness of what co-regulation is. People in medicine do not know that term. They don't know what that means. And so one of the things I love about co-regulation is reframing for physicians, particularly because this is hard work, right? I think part of the reason that healthcare workers compartmentalize so much is because there sometimes isn't an answer, right? Like we've kind of forgotten because there are so many more medications now than there were even 40, 50 years ago. There's more procedures, there's more technology. And there are times where we don't have answers or we cannot help, or there is pain and suffering that can only be mitigated. And it can be mitigated perhaps through external means like pharmacology or medications, through other sources of comfort. But there's also an internal mitigation that the patient needs to go through around their own process of illness and disease. And that's the art and the depth and the mystery of medicine. And I don't know how you fit that in anymore, but I do know that for me, it's that soulful connection to this work that keeps me doing it. Is wanting to understand this place where we're helping people relate to their illness, in addition to saying like, yes, like, you have cervical interest, like you have neoplasia that needs a leap or something like that, right? Like that is also really helpful. So. But there's also times for really practical parts of medicine, right? Like if you have this has actually changed now, but for a long time, if you had appendicitis, getting the appendix out was what you needed, right? Like, or if you have a gallbladder that's about to rupture, surgery will save your life.
That's it.
IV antibiotics for sepsis, absolutely game changer, right? But you look at what we do for chronic disease, and this is where preventive healthcare, right? Really, we need more exercise, more movement, more access to good nutrition. Then we're getting stuck again in these structural determinants of health, right? And that's a harder conversation. It's a harder conversation to have with your patient living in Oric who doesn't have a car, who isn't able to access anything but that one store that's there, how to help get them fresh broccoli, right? Like, and people, when you're scheduled for only 20 minutes with people, I mean, I think that healthcare clinicians are really handed a set of fairly impossible circumstances. And I mean, I am very privileged in that I only do a day a month at Kamau, a day a month at United Indian Health, and then work in the hospital. But then for the most part, I'm practicing, on my own in a really different model, which is an incredible privilege. But it's also allowed me to see as this practice, which was originally just me for 2 years and now has been a group practice for 3 years. Well, our goal for the year was accessibility. That means opening to insurances and other payers. I've been in the process of credentialing with Medi-Cal for our county for going on 11 months, and I was initially like, what is wrong with me or us? Like, why? And it's long. It's just long and it's arduous. And I understand, and this is not to call that particular health plan out at all, because that is true of, we did the same thing with Medicare, which we now accept. It's just, it's hard. And then I see how people have to crunch their models. I think I'm watching it from the inside out in a way that when you're just in it as an employee physician, you're just like, okay, now I have to do what these people tell me and I have to see 10 to 12 patients in a half day. But now I'm like, oh, I get it. When they only pay you X to see a patient, you actually can't keep the doors open. So it is complex, but I think we feel better when we think about the why, when we think about the meaning. And I think the process goes better when we know how to communicate better, which for me, polyvagal theory has been a tremendous benefit. And then truthfully, the mediation training I took through UC Davis this year feels like it was a huge
Game
help.
changer.
Game changer. I was like, why are physicians, like we should be taught conflict resolution and kind of typical conflict styles and how to manage hard conversations.
I feel like something that, one, I'm gaining a lot of empathy because sometimes we want to be like, well, why isn't the system better? And it's like,
Totally.
well, the system is beyond, I think, a lot of our understanding.
Yeah.
It's controlled by a lot of dark sources,
Yes.
or,
Yeah.
whatever. But one thing I'm thinking is we have to kind of lean on community
Mm-hmm.
to kind of help in that. If we have physicians who are getting burnt out, or we have physicians who have these unrealistic expectations for how they show up on their work, how they show up with patients, how they show up in their life, then it's kind of our job as community to support them in that, like to support them outside of that,
Yeah. I mean, yes. Open Doors done for their second year now. They're doing this rejuvenation and resiliency retreat. And Dr. Malia Honda, their associate medical director, is really the one, or CMO, has really been the one pioneering that. And one of the things I love about her as a leader is she's so confident that community, like bringing people together, and this is her family's message too, bringing people together in community will heal them. That will always be a source. And I think that that's very true. And even I don't think that people necessarily realize the amount of input that's coming at clinicians, especially in primary care. You're really not given the ability. I mean, you're trying to manage med refills, you're trying to get your notes done, you're trying to follow up on this letter for this patient. So I have a ton of empathy for my colleagues who are still doing that, like, absolute frontline primary care work.
Yeah.
Yeah.
Yeah, I think it's so exciting to see our community build those different structures of support, like you offering a training, or, that retreat. That sounds really beautiful. And I know that, in First Five, we do a lot of work with different physicians to kind of try to elevate those things. And it is hard when it's in a system. But I think, again, it's like that special thing about Humboldt where we do show up in community in different ways so that people feel supported in other ways. So thank you for tackling that question that was a little bit tricky. When I was trying to think about where I wanted to take this conversation, I felt like I was so curious about you and your work that it was hard for me to like narrow it down, because I'm like, well, we could spend a whole episode talking about addiction and pregnancy. We can spend a whole episode talking about just like birth or this and that. So I think I kind of like packed in a lot of things, but I'm really appreciative of where the conversation has kind of been going. I did a poll on our social media to see what folks wanted to hear about. The thing that came up the most was pregnancy and addiction.
Yeah.
So I just have a couple of questions that if you want to try to tackle them.
Absolutely.
You've already spoken a bit about this, but you support many pregnant people navigating substance use and trauma. What do you wish more providers or systems understood about that experience?
The one thing that I often say when I'm talking to other healthcare workers about people who are using substances while pregnant is that they definitely don't want to be using substances while they're pregnant.
Yeah.
Right. Like, so just to be clear, they're already, as much as you might have an internal judgment or just a sigh of like, oh, this is going to be so socially complicated. They do not want to continue to use.
Yeah.
Like that really they're hoping to enter recovery, and it has gotten so much harder to do that for people who are using opioids in the form of fentanyl. Fentanyl withdrawal is just more complicated. So that would be the primary thing, is that we cannot fathom how severe their internal stigma already is. Yeah. And so steadiness, gentleness, I do think language, the other thing I would say is language matters. And this is where NIDA, the National Institute of, my goodness, I believe it's drug abuse, but double check me on that. That just sounds so antiquated nowadays.
Yeah, I'm like, wait,
anymore? And I'm about to say this thing about language that's like their bracket, but I can be wrong. And but I often find people default into like the language of clean, right? Like oh, they're getting clean, and totally fine for people who have a substance use disorder to use that language. When I use it as a physician, there's this inherent stigma, right? Like, because what's the opposite of clean? It's dirty, right? Yeah. So I think really educating yourself on language, that sounds like a nothing trivial thing. It's not. It's not. Language is this is how we communicate to each other. I mean, the fact that we have language, I can really get far out there when I start to think about like, how did we even introduce, like, this is wild that we even have this tool to communicate. But so our words make a big difference. And I would say that's one of the most common things I see, and I've heard a lot more recently, actually, when people have maybe called for consults or to talk through a case, I'll hear them kind of default into the language um, of again that like clean versus dirty, and that's an easy one to erase from your vocabulary.
What a good reminder, because it kind of speaks to what we talked about earlier. Even if they're not conscious that it's a triggering word for them, maybe subconsciously it's triggering something in them.
Right, implicitly. I mean, we think, and one of the ways we learn is through contrast, right? So like there is a part of us that's like, if I hear clean, I'm thinking the opposite, right? Yeah.
Do you have any advice as someone who works in this world for families who are trying to support their loved ones through that?
Oh my gosh. So first of all, tend to your own heart first and foremost, because you are being asked. It is so hard to see a relative, a loved one, a friend who is just so stuck in the process, and they're not able to have just enough clarity to kind of pause and start making some different decisions. So tend to your own heart, and part of that does mean protecting your boundaries. If you do have someone in your family who has in an altered state, if they have assaulted or abused you or robbed you, I mean, those are real things that happen. Those are real forms of harm. And sometimes it is, in fact, the most loving thing to have a firm boundary, but a firm boundary with resources and support. That doesn't mean you should financially support your family member forever. That's not even possible for most families, especially nowadays. But I do think it behooves all of us, especially when we live in a community that's this size, right, to have a little bit of knowledge of where you can access services, right? We have 3 residential treatment centers in this county: Waterfront, Humboldt Recovery Center, and Crossroads. These are all places where people can go for a higher level of care. Knowing where they can access it. It is also really hard where we don't have a lot of options for people who need to go through a detoxification or a withdrawal process in a controlled place. Waterfront's really the only option, or the hospital. I've never worked in a community like this where if I have someone who's had certain complications, particularly from alcohol withdrawal, I have to fight or beg for them to get admitted to the hospital. And even that, it often doesn't happen. So I think knowing resources, which there's a decent sized community of, peer support and 12-step programs up here. And I have seen in my own life and network of personal connections, I have sometimes seen that it really does take the firm but connected no, right? Like, I love you and I can't be in contact with you right now. That actually can create change. And that's not always right either. But I think that sometimes it is important to at least ask yourself the question of, am I over attuning versus where else can I provide support?
Thank you for that. I have so many other things that I want to touch on, but I will end it with one question. What gives you hope right now in the world for healing and care?
That is a great question, because even this afternoon, after I finished kind of my morning of things, I pulled my phone out and hammered texts of people grieving about the state of the world right now. I've thought about this a lot. So where I am finding hope is by staying connected to myself in the present moment. And I say that from the place of embodiment practice. Because in this moment right now, you and I there's never absolute safety, right? Anything could happen right now, but in as much relative safety as we could have, we are sheltered, we are safe. You are a warm, friendly, delightful human. We are talking about things we're interested in. In this exact moment, my body is not under threat. In this exact moment, I'm connecting with another person. And so that practice of coming back to, in this moment, what is actually happening? What am I actually experiencing? I think it seems, if you're not actually connected to your body, it sounds like I'm giving you a weird bypassing picture. But really, I'm like, no. Bring your awareness back to what's happening inside your skin. Like, what is in your boundary of being? Because this isn't, not that we can control precisely what happens here, but we can choose, right? We at least have the option for agency and where our attention is going. And then the other thing that I was actually reflecting about and writing a little bit about this morning is that, hopelessness is it's one of the criteria, right, of major depression. But it's usually, we're so frozen in it. And I think one of the best antidotes for hopelessness is movement or action. And sometimes we move or act without maybe even really feeling a lot of hope. But there's this great quote from Goethe, the German writer, about how there's boldness, there's genius in boldness, right? Like act, and I version of it. But his point is that there's sort of a reward that comes when you move, when you act, when you stay connected to just activity instead of the freeze. And sometimes the freeze needs to be honored, but even, I mean, in somatic experiencing, when we're teaching, when someone's in freeze, you want to invite them to move.
Yeah.
Right? Like find the smallest movement that feels available. Maybe that's just the breath, but that would be one part of it. So I would just invite all of us to really track yourself, stay in your center, find what feeds you that place of hope, and then play. Get creative about what you can create in this space.
You spoke to my heart. And at the end, play. Thank you so much for sitting down with me. I think I could talk to you for hours.
This has been so fun. Thank you so much. I really, really appreciate it.
What an amazing conversation, folks. Dr. Carrie Griffin was so lovely. If you want to learn more about her, check out carriegriffin.com. Also, stay up to date on all things First Five Humboldt by following our Facebook or on Instagram at First Five Humboldt. And we want to invite you, by the time you listen to this, July, if you are an expectant parent or have a baby under 3 months old, we are hosting a community baby shower at Pearson Park. So check out our social media for more details, and we shall chat soon.